Foundation Module 5. Use Modular Integrated Undergraduate Curriculum Physiology. Dr. M. Ashraf Thind. Senior Demonstrator Sheikh Zayed. Medical College Physiology Department, Founder and CEO of Dr. Sheen. Medical Lecture, Superfast Simplified Physiology. Video Lecture Notes. Gaetan Hall 14 Edition, Chapter Number 42. Respiration, Pulmonary Ventilation, Lecture Number 5. Learning Objectives. Explain periodic breathing. 1. Cheyne-Stokes breathing. 2. Causes of Cheyne-Stokes breathing. 3. Mechanism of Cheyne-Stokes breathing. An abnormality of respiration called periodic breathing. It occurs in several disease conditions. The person breathes deeply for a short interval and then breathes slightly for an additional interval, with the cycle breathing itself over and over. Cheyne-Stokes breathing. It is a type of periodic breathing. It occurs in various disease states and is often called Cheyne-Stokes breathing. Respiration is characterized by slowly waxing and waning, increasing and decreasing respiration. It occurs about every 40 to 60 seconds, or periods of apnea of 5 to 20 seconds, separated by approximately equal periods of hyperventilation when the tidal volume gradually waxes and then wanes. This pattern is frequently seen at high altitude, especially at night during sleep. Causes of Cheyne-Stokes breathing. 1. During deep sleep. 2. In high altitude. 3. After prolonged voluntary hyperventilation. 4. In newborn babies. 5. After severe muscular exercise. 6. During increased intracranial pressure. 7. During advanced cardiac diseases leading to cardiac failure. 8. Damage to the respiratory center of the brain. 9. During advanced renal diseases leading to uremia. 10. Poisoning by narcotics. 11. In premature infants. Mechanism of Cheyne-Stokes breathing. When a person overbreathes, hyperventilates, reducing too much carbon dioxide from the pulmonary blood at the same time increasing blood oxygen, it takes several seconds before the changed pulmonary blood can be transported to the brain and prevents the excess ventilation. By this time, the person has already overventilated for an extra few seconds. When the overventilated blood finally reaches the brain respiratory center, the center becomes depressed, and the opposite cycle begins. That is, carbon dioxide increases and oxygen decreases in the alveoli. Again, it takes a few seconds before the brain can respond to these new changes. When the brain does respond, the person breathes hard once again, and the cycle repeats. The basic cause of Cheyne-Stokes breathing occurs in everyone. However, under normal conditions, this mechanism is highly damped or suppressed. That is, the fluid of the blood and respiratory center control areas have large amounts of dissolved and chemically bound carbon dioxide and oxygen. Therefore, normally, the lungs cannot build up extra carbon dioxide or depress the oxygen in a few seconds to cause the next cycle of the periodic breathing. However, under two different conditions, the damping factors or suppressing factors can take control and CHEYNE-STOKE breathing occurs. When a long delay occurs for transport of blood from the lungs to brain, concentration of carbon dioxide and oxygen of the alveoli and pulmonary blood increased. Then, brain detects changes and gives response. After few seconds, Cheyne-Stokes breathing occurs. It occurs in cardiac failure, and heart cannot pump blood properly, and pulmonary blood takes some time to reach brain. Then brain suddenly detect too much carbon dioxide level and hyperventilation occurs. This is basically Cheyne-Stokes breathing. A second cause of Cheyne-Stokes breathing is increased negative feedback gain in the respiratory control areas. Change in the blood carbon dioxide or oxygen causes change in ventilation. When partial pressure of carbon dioxide rises 3 mm mercury, it increases ventilation 10 to 20-fold. The brain feedback is very sensitive to cause Cheyne-Stokes breathing, and decreased carbon dioxide stops respiration for few seconds. This type of Cheyne-Stokes breathing occurs mainly in patients with damage to the respiratory centers of brain. Cheyne-Stokes breathing of this type is frequently cause of death from brain malfunction. Note that the partial pressure of carbon dioxide of the pulmonary blood changes in advance of the partial pressure of carbon dioxide of the respiratory neurons. However, the depth of respiration corresponds with the partial pressure of carbon dioxide in the brain, not with the partial pressure of carbon dioxide in the pulmonary blood where the ventilation is occurring.